Alright. Welcome back, everyone, to the Schnightmares podcast. I'm Frederick John Schneider IV.
I'm Sabrina Schneider.
And today we have Gabby Curry on the podcast. Going to talk a little bit about being a nurse right now during the
Doctor. She's a doctor.
She's a doctor. Yeah, she's a doctor. You're right. Okay. Let's try again. Today we are talking to our friend Gabby Curry. We're going to go over what it is like to be in the medical field, working in a hospital during the COVID-19 outbreak of 2020. Okay. That's a little too much.
Did she not
Hello.
Oh, she did.
I hear Gabby, and I see Gabby. Hi.
Hi.
Hello.
How are you?
Sorry. We're gonna move that over here. Come on.
Who's that little guy?
Okay.
Is that Lionel?
This is Lionel.
Wow.
Aww.
He had his first vet appointment today. So he's a little traumatized.
Aww.
Sure.
Just like a checkup kind of appointment or what?
Yeah, since I found him on the street,
Gotcha.
I didn't know if he was vaccinated or anything, so he got vaccinated, got chipped. Yeah, and I think he's about 1 year old, and he weighs 6.4 pounds, so he's like 7 pounds smaller than Lola.
Oh.
Nice.
Yeah. So
A little thing.
my little baby.
Yeah, thankfully today's my off day, so I slept for 12 hours and
Good.
Nice.
I'm
Lionel to
sure.
the vet.
Yeah.
Made myself a very large Long Island iced tea, and that is all I've done today.
Good. Good for you. Good for you. I'm sure you needed all of that. Yeah.
Well, Sabrina, do you want to start with who Gabby is to us, and then Gabby will turn it over to you to kind of talk about your childhood, your career, kind of who Gabby is. Yeah. So,
Cool.
Sabrina, tell us about who Gabby Curry is.
So, to our viewers, whoever that might be, Gabby Curry is someone we have both known for a long time. I don't remember meeting you. Just known you. Grew up like in church together. Just kind of always been like someone there. I guess Gabby is a bit closer friends with my sister, was like a bridesmaid in my sister's wedding. And so, yeah, gotten to connect with Gabby through different things, through church and through mutual friendships and all of that. And she's pretty cool, pretty fun, pretty funny, and all that. And we're going to talk to her today. So, yeah.
Yeah, definitely. Gabby, who you are to me is definitely like the loudest laugh. Like my biggest memories of you is just like going on retreats with the church group and you being such a just like a presence of joy, and definitely like the biggest laugh and the one who can just like spread joy infectiously to everyone. So that's to me. You may not be feeling like that right now, but to me, that's how I see you. So, for what it's worth, that's you to me.
That's really encouraging.
Yeah. But
So
you tell us about you.
So like Sabrina said, was raised in the church. Lived in Kansas City for basically all of my life until I was 26. So went to private Christian school, was in Awanas and various youth groups, did all of the church on Sundays and youth group or Awana on Wednesdays and prayer meetings on Tuesdays. Was very heavily involved in the church growing up. And when I was about 16, I was over at a friend's house and we were watching Discovery Health, and there was some show about labor and delivery. And when I saw that, I was like, that's the coolest thing in the world, and that's what I'm going to do. And so that's kind of when I decided that I wanted to become, actually, at that point, I didn't even know what you had to be to deliver babies. I just know I wanted to be somebody that delivered babies. So I went home and told my mom that. And so she told me about being an obstetrician, and that would involve going to medical school. And so that's when I decided I wanted to become a medical doctor. And so I applied to one college because I'm an idiot. But thankfully I got in. So I went to UMKC, the 6-year med program that they have. And my intention the entire time was to become an obstetrician. I never wavered from that really at all. During the first really 5 years, that was pretty consistent. I did high-risk OB electives, and everybody in my class, all of my teachers, knew that I was going to become an obstetrician. But when I was 21, so that was just before starting my 3rd year, I went to Tanzania on a medical mission trip that I had planned by myself. I went by myself and met up with this doctor that was working in a clinic there. And when I was there, I got to participate in a variety of things, but one of those was in the labor and delivery clinic, which is what I was obviously most excited about. And I saw one delivery, everything went fine. I just kind of observed, and it was really awesome. But the next lady that came in had a more complicated situation. There was only one other lady in the clinic, and she was also just a volunteer. There was a language barrier. She spoke mostly Swahili, and I obviously don't speak a lot of Swahili. I could have like a very minimal conversation, and the same with her in English. So there was a lot of just miscommunication, and the baby, when he was delivered, wasn't breathing well, and she delivered him, cut the cord, turned around, gave him to me, and said, "Suck, mouth, nose," and then walked away. There was nobody else in the clinic for me to be like, I don't know how to do this. I've never even held a newborn baby, let alone tried to resuscitate one. Wow. And so did the best that I could, but he ended up dying, and I was immediately told this baby should not have died. This was a senseless death, and so I just took on a lot of guilt and really felt that I had killed this baby. And then about 30 or 40 minutes after that happened, the mom started hemorrhaging, and she ended up dying as well. And that was my first experience with death, and my first experience really being involved in any meaningful way in somebody's crisis. And so to have that be the first experience, to have both people die, one of them being a newborn baby, and for me to feel like I was blamed for that was really, really traumatic.
I bet.
And I got back from that trip on a Sunday and started my first year of like the actual medical school classes on Monday. So there was like no processing time.
Oh, man.
And that was just a really traumatic time in my life. I became very depressed, suicidal, tried to kill myself once during that time, but still was like, I'm going to become an obstetrician. I'm going to like get through this, and it's, this is just going to be one of the testimonies that I have of how God has like transformed this whole situation. So kept pressing on, and then in my last year of medical school, my very last core rotation was surgery, and one of my very first surgeries, I go in, and it's this huge male physician that is the surgeon, and he was just asking me all these questions. And whenever I would go into the OR, I would start to feel more anxiety and just had this feeling like if I touch anybody or do anything, everybody's going to die. Even though that's not realistic, that's, you know, just kind of what my brain was saying because what had happened in Tanzania. So he is, we call it pimping in medicine, when somebody like asks you repeated questions trying to embarrass you or just ask until you get something wrong. So he was pimping me really heavily, and the phone rang, and it just startled me, and I had a full-on, like, just epic panic attack and meltdown in the middle of a surgery. Like, the lady is on the operating table. I fall, am on the ground, hyperventilating, crying, chest pain.
Oh, Gabby.
And literally the surgeon is standing over me screaming, "Somebody get her out of my OR!" So, sorry, buddy.
Literally, like, people are dragging me out of the OR. And it's hilarious looking back. In the moment, it was
Not so hilarious.
Not so hilarious.
And of course, that was the day that I was on a 24-hour shift. So it was like, great, I'm halfway, like 12 hours into my shift. I have 12 more to go. This is awesome. So yeah, after that, I really started to kind of question, is this what I'm supposed to do? Because, you know, if every time I get into a stressful situation like this, I have a panic attack that I can't control, you know, at some point I'm going to be the attending physician in the room. And what if I have a panic attack then? And so I really began to question whether becoming an obstetrician, because, you know, that would entail very high stress situations, doing surgeries, being in an OR.
Finally, I just kind of settled on psychiatry because I was like, this is too much unknown, and it feels too risky, not only for me, but also just for the patients that I would be taking care of, to go into a surgical specialty. So I did psychiatry and match. So the way, do you guys know how like the medical school match into residency works, or
I've heard vague things, but I wouldn't say that I fully understand it. No.
Yeah.
So just real briefly, you go to medical school. Everybody in med school graduates with the exact same degree, so we all have a medical degree. Then you apply to your various specialty, and it's kind of like the NFL draft, where you make a list of places that you would want to go, and the schools or programs make a list of students that they want to take, goes into a big computer system, spits out a match, and then on the third Friday in March, you have this big ceremony where you open your letter and you find out where you're going. So it may be your first place on your list, or it may be your very last. You don't know where it's going to be, but that's kind of how we figure out where we're going to go to do our specialization training. So again, everybody graduates with a medical degree. Then in residency, you do your specialization.
Okay, yeah, I guess I didn't realize that at all. I didn't know it was like they choose you like that. Yeah,
it's
interesting.
It's a horrible day because it's like a huge ceremony. So everybody's families are there, and you all open your letter at the same time. So you have people that got their number 1 that are like crying tears of joy, people that got their number 15 that are sobbing uncontrollably.
Oh gosh.
Like are in relationships that are now being separated. So like families are torn apart, and people are finding out like their dream is coming true all in the same like moment. So
wow, yeah, that's something.
It's so brutal. It's just like such a brutal field. Like, wow. Yeah. Not for everybody.
It's like, it doesn't need to be this way. Like, just send us the email and tell us where we're going. Don't make it be this whole
like let people like sob in the peace of their own home. Gosh.
I had a panic attack that day because so my number 1 program was Boston, and they, like the program director, like the head boss had called me and she said, we love you, we want you to come here. So I was like, oh, this is where I'm going. And, you know, obviously didn't know for sure, but was pretty confident. And then when I opened up my letter and saw Howard in D.C., I just like, I wasn't mad or sad or anything. Like I was just in shock. And so I'm like doubled over having a panic attack, and I hear one of my family members go, is she happy? It's just like, I don't know what's happening.
Oh my God.
Yeah, so that's how I ended up in Washington, D.C. My first time outside of Kansas City, working at an HBCU, historically black college and university. Yeah, so that's kind of who I am and how I got here.
All right. Wow.
Wow, indeed.
Yeah. Gosh. Medical field's not for everybody.
I couldn't do it.
I
couldn't do
couldn't
it.
either.
I mean, I'm impressed with anybody that's in the medical field. I couldn't do it.
Really. I mean, even before there was a pandemic, I was already impressed.
Consider that a win.
Yeah.
Oh, I'm also like $500,000 in debt, so.
Yeah.
So there's that, but yeah.
Oh, every part of it is so brutal. Dang, that's wild.
So yeah, now that you've been moved, because you're doing the psychiatry, but now you've been moved back to the OR, right, for the pandemic? Is that right?
How did that happen, by the way? I'm just to get the details on that. It's interesting.
Yeah, so basically, when everything with the pandemic started happening, we heard more so in like New York, where things were really bad, about residents being quote unquote redeployed. So you would be taken from whatever specialty you were training in and placed back in, we just call it medicine, but that entails like internal medicine, working in the ICU, things like that. And so we heard about that happening, but things weren't quite that intense in DC yet. But then as things have started to get worse here, we're expecting our surge to happen in May. So kind of things are bad, but they're not like that bad yet, I guess. So on Thursday of last week, that's the day that the psychiatry residents have all of our meetings, and we talk with our program director, and have different lectures and things. So our program director told us that some of us were going to be redeployed to medicine. And she asked if there were any volunteers, because it was kind of like we need people to do this. If nobody volunteers, I guess people will just be chosen. Yeah. But if there's anybody that's willing to volunteer, that would be great. So I was one of the people that said that I would be willing to go. I think for me it's a lot easier because I'm not married, I don't have any kids. It just feels less risky for me, whereas some of my colleagues are married, have 2, 3, 4, some have 5 kids. And so I volunteered, but wasn't really expecting that it was actually going to happen. It was kind of like a worst case scenario.
Oh yeah.
This happened. They just want a list of names of people who are willing. Yeah. So that was Thursday, and then Friday I get an email saying you are being assigned to renal consults, and you're starting on Saturday. And so renal is working with the nephrologists who are the kidney doctors. And so when I volunteered, I was expecting to go to medicine, which is just like internal medicine. In psychiatry, your first year, you have 3 months of internal medicine that you do. So it's something that at least was like a little bit familiar, even though I haven't done it in several years. I don't think I've said that. So I'm in my 3rd year of psychiatry residency right now.
Okay.
And third year for us is all outpatient. So I haven't even been working in the hospital, not even with like psych patients in the hospital, in about a year. So not only was I going back to medicine, but I was specifically going to the renal consults. I've never done a renal rotation in my life, not even in med school. My last ICU rotation was in medical school. And so I show up on Saturday, and she's like, we're seeing all COVID patients, and a lot of our patients are in the ICU, or either the medical ICU or the surgical ICU. And have at it. So that's kind of how I ended up.
It's kind of tossed in the deep end there.
Yeah.
Sounds like. Yeah.
Great. Great.
Oh my gosh.
Wow.
This is my ideal situation.
Yeah.
Of course. So yeah, what's it like there at the hospital? You know, what's your day look like there?
Yeah, so I wake up in the morning. Typically, I'll check on my patients at home, so we have remote access. So I'll get on my computer and just check the list, see if any of my patients have died, look at their labs, and write down as much information as I can while I'm still at home. And then the time that we round every day changes. So rounding is when the attending, who is like the head doctor of the service, they come in and we discuss the patients all together. Sometimes we go and see the patients together. Other times we just sit down at the computer and look at the labs all together, and the resident who saw the patient presents what they found when they did a physical exam and all that stuff. So the time of rounds changes every day, but I just have to see all of my patients before rounds start. So if rounds are at 9, I might get to the hospital at 7. If rounds are at noon, I might go in at 9. Or, the times kind of vary. So yeah, go in, I will see my patients.
I have been carrying like 6 to 7 patients, and some of them are in the ICU, whether that's medical ICU or surgical ICU, and some of them are just on the floors, which just means admitted to the hospital for another reason and not sick to be in the ICU. Some of them are COVID positive, some of them are not. So for the COVID patients, have to gown up, do the whole, I wear an N95 mask, which is like a specialized, really tight mask. And then I wear a surgical mask over that. And then I wear a face shield that is kind of looks like a welder's.
Or like a riot police.
Yeah.
I used to wear something like that at one of my jobs. Not like your job, but yeah.
They're the worst because you can't breathe. The masks are fogging up.
Yeah.
I can't see. I can't breathe. This is fine. And then I put on my gown, the gloves, go in, see the patient. If they're on a ventilator, there's different settings that we write down. Do a physical exam, so listening to their heart and lungs, and their abdomen, seeing if there's any swelling. Since I'm on the kidney service, checking if they're fully catheter, if there's any blood in it, things like that. And so I'll do that for all of my patients, and then go to rounds, and we'll discuss the attending. And different attendings do it different ways. The lady that I'm working with currently has just been so supportive and understanding that this is not what I have been trained to do. So she's been really gracious with not pimping me or
That's
expecting
nice.
me to remember all of this stuff from medical school that I haven't used in 3 or 4 years. But yeah, we'll talk through all of the patients, come up with the assessment and plan or the recommendations that we have for the primary team. And then the rest of the day is just if there's anything I need to follow up on, from the morning rounds or just waiting for new consults from the emergency department or the medical teams or the ICU.
Hmm. Are you dealing with like equipment shortages right now at your hospital, like I've heard about, or how's that?
Yeah, so we're being asked to save some of the masks. So like the N95 mask, I'm not changing that every time I see a patient, not even changing it every day. But the surgical masks, I'm throwing away at the end of the day. And using a new one of those. The face shield, I just have one of those, and not everybody even has gotten that. Somebody in the psych residency, her medical school, really graciously donated these face shields for the psych residents. So we all have them, but not everybody has gotten that. So at the end of the day, I just clean my face shield, like wipe it down with the special wipes, and but we haven't, the shortage in DC has not, or at least at my hospital in DC, hasn't been as severe as what we're hearing about from New York.
Yeah.
Well, that's good.
Yeah.
Are you ready to dive into the whole conspiracy thing? Because, oh boy. I'd love to just kind of tell you where like my level of exposure to it, because I actually have a close family relative that's super into all that stuff. I mean, a lot of people know these people, and it's almost like a subculture that seems to keep growing in size, and it's every tragedy, every every disease, every shooting, there's always some other thing behind it. It's always like either fake or the government did it or something like that. So I have a relative that's basically bases his life around these conspiracy theories, and so I've heard, I've had that face-to-face conversation about it, so, and he always wants me to watch these videos and like the proof, you know what I mean? Have you heard about the hashtag is it's film your hospital or something like that? So basically, the theory is, well, there's many, but the most insidious one, in my opinion, and you may agree or disagree, is that the virus is not actually like killing people, and the numbers are all fake. And so what it is people are taking their cell phones to hospitals and filming them and saying like, oh look, nothing's happening, the parking lots has few cars, and like all of the footage you're seeing on the news is like actors, and they're like setting up the whole thing to look like a real tragedy, and really what's actually happening is it's just like the flu. Like that's basically the line of thinking. And so this hashtag film your hospital is like super popular right now, and I'm wondering what your take on all of that is, and if you maybe have some eyewitness accounts that might refute those claims, perhaps.
Yeah.
It's a lot to take in, huh?
I've not heard that one. I've heard that like it's all a hoax, but so a couple things. One, yes, there probably are less cars and things going to be in the parking lots and that you're seeing, because as much as possible, we are telling people don't come to hospitals right now, because by coming to a hospital, being in a hospital, you are exposing yourself to the sickest of the sick, right? So like if this is, we're not doing elective surgeries right now, so your boob implants and like things like that, like that's not happening right now because it's not worth the risk. We have, and obviously this is going to differ from hospital to hospital, so what I'm saying is what I've seen at Howard and things that I have heard from my friends working at other hospitals, but I've definitely gotten into a couple like Facebook arguments with people that are like, well, I'm at this hospital and none of that's happening, and I'm like, well, pray it stays that way, because like just because it hasn't exist in your area yet doesn't mean that it won't. Yeah, so we have entirely closed, like, the psych clinic isn't even open for patients to physically come in anymore. Like, the doors are locked, nobody's inside. We're doing all telehealth. So as much as possible, we are doing visits online through Zoom or, some other app or website. Again, we're not doing any elective procedures. And so we're trying as much as possible to keep people out of the hospital. The cafeteria is completely closed other than for the healthcare workers to go in and get food, but like we can't sit down in the cafeteria. We're not allowing any visitors into the hospital. So, if you have a loved one that's sick, you can't come in and visit them, just to try and reduce the number of people that are getting sick. So that also means that some people, even in hospitals, are losing their jobs. So, not every essential worker is getting to keep their job or being required to still come to work during the time. So, like, with the cafeteria being completely closed, we don't need as many people working, either in the kitchen or staffing the cafeteria, and the clinic workers, we don't need as many medical assistants and things like that. So, the parking lots and things are going to be more empty. There's not going to be as many people in the lobbies or, visiting because it's not allowed right now. So that's one piece of it. The other is, even if you are filming your hospital, unless you get onto an actual medical floor and start filming, which is illegal, like, you're not going to see any of what's really going on there. So, like, that doesn't mean anything just because you didn't see anybody in the lobby or outside the hospital. And just as far as, like, people not dying, like, that's just not true. I've had patients die. I'm going into the ICUs every day and seeing patients that are on ventilators, that are struggling to survive. I had a 26-year-old patient die. So it's not, just old and really sick people. People really are dying. And, like, I don't get anything out of saying that. Like, I'm not being paid by the government to, say that people are dying. Like, I have come home every day, and I've only been redeployed for 4 days. This is day 5, I think. And I've come home every day and just sobbed. Like, I'm not getting anything out of this. This isn't fun for me. I'm not trying to trick people. I'm not being paid by anyone. I'm not getting more money for doing this. So that's, people are definitely dying. And as far as, like, where it came from, like, the government being involved, I personally don't think that is what happened, but regardless of where it came from, it's here and it's happening. And if you want to spend your time saying that it's all the government, like, I disagree, but as long as you're staying inside and not infecting other people by going outside, we'll agree to disagree.
Yeah.
I've also seen posts. Of course, it's just like, I don't know, posts. There's so much information just everywhere about, like, people who die in the hospitals from other things. Like, if they test positive for coronavirus, that's, like, being listed as the cause of death, even if it's not. I don't know if you have anything to say about that.
I don't have anything to do with, like, as far as the death notes,
the autopsy or
listing
that
the
kind of
cause of death. I'm not sure, but again, nobody is, at least not on, like, my level. We're not getting anything out of this. Like, we have nothing to gain by listing a false cause of death.
Right.
So that just doesn't make sense. Like, where's the motive, I guess, to do something like that? If they have if they were COVID positive, we would obviously report that so we can have as accurate numbers as possible for how many, patients there are. But I haven't heard about anybody listing a false cause of death. But I guess the other thing is that coronavirus can cause a variety of organ failure. So it's not just the lungs, like it's impacting a lot of other things. So we're seeing the levels of clots increase. So really young patients with no risk factors are coming in with strokes. And
Yeah, I got that. That's crazy.
yeah, so the cause of death might be a stroke, but in somebody that has no other risk factors, and the only reason that they had that stroke is coronavirus. So like it's more complicated, I think, than just like they died from the respiratory failure caused by COVID-19 pneumonia. It could have been caused by a stroke from COVID-19 induced clotting.
That makes sense.
Yeah.
Yeah.
Yeah. The different, like there's a difference for me in the prevalent conspiracy theories, in that there's the ones where it's like the government's like unleashing this virus and this and that, where the government is the villain or whatever, and like that's nothing new, that's not going away, people don't trust the government, it's going to keep evolving. But the one that's implying that nurses are lying, that like the people that are just doing their job and are, like you said, are like coming home and like sobbing, like really in a stressful traumatic situation, and then on top of that being called like liars, that's a whole other animal for me, and I can only imagine like what that would feel like. And I'm just wondering if there's anything else that you would want to say to a person that would be spreading something like that.
Yeah, I definitely agree. That is something that really, really offends me. Because again, like I'm not getting anything out of this. I have nothing to do with the government, other than like voting, go vote people. But yeah, like for me, I think in my experience, being a doctor is portrayed as this super glamorous, like, living the lifestyles of the rich and famous, sort of, I don't know, it's just not that way. I guess like you're hundreds of thousands of dollars in debt. You come in and no matter what field you're in, you are giving people these recommendations that you have spent years, like decades, training for and studying, and again, like being in ridiculous amounts of debt and these super stressful tests and all this stuff that we go through to get the training to be able to make these recommendations that are based on our best knowledge. And like obviously things are always changing and we're learning more. What we knew 100 years ago is not what we go by now, and so constantly learning and changing, but we're doing the best that we can. And to have people say like, oh well, my friend Bob that I went to high school with, that is working whatever job, and not demeaning any other line of work, but you're not trained in this. Like there is no reason that you would have better knowledge about this than I do, or than Dr. Fauci does. Like for you to feel like you can come in and just say, like I read this article and now I'm an infectious disease specialist, or I'm a pulmonologist, like is ridiculous and extremely offensive to those of us in the medical community. Like I wouldn't come to you, Sabrina, and be like, well, I took an art class in 10th grade and So really you should be doing everything this way, or my friend so-and-so that I was in this art class with, they said this is the way to do it. Like that would offend anybody, like in your line of work that you've worked incredibly hard for. To have people come in and say, well, I know better because I saw something on Facebook, is just like, please just shut up and get out of my face. And when you add the level of, I'm going into a space where I'm putting myself at risk for not only getting sick, but also potentially dying. Like, please don't say that I'm lying or I'm doing this to gain something, because it's just not true. And I think I started to say and then got sidetracked. I told you I'm long-winded.
That's fine.
But yeah, medicine can feel like a very thankless job where you do all this training, you make these recommendations, and then people are like, yeah, I don't think so. I'm just gonna go, a different route, which is like, that's your prerogative. You're allowed to do that. But it can be very frustrating, especially when they then come back and are like, I don't understand why this happened. And I'm like, well, we definitely had this conversation, and this is a choice you made.
Imagine that's frustrating. Sure. Yeah.
But then like
Frederick, you said at the beginning, like it is a different level when people are calling you a liar and like maligning you.
There's definitely a level of hostility right now with that. So yeah, I'm sure that's pretty intense. And
what also sucks about it is, like you said, like taking a phone in and showing what's actually going on is illegal. So basically what they're saying is like, you're a liar, and it's ingenious because you can't prove that you're not, because like, I can go outside in the parking lot and show this, I can have this insidious post that, cherry picks information. And then when it's like, well, why aren't where's the proof? And then you can't. Right.
Doctors can't be just taking pictures of all their patients and being like, hey, look at this person dying right here. Right. Yeah. So, yeah.
I got into it on Facebook with, and I think it's somebody that's a nurse, working as a nurse in Kansas City. And they were like, it's all just fear mongering. Our hospital is basically empty right now. Our ICUs are not overwhelmed with patients. This is all, just ridiculous, and they're just trying to make people afraid. And I'm just like, as somebody in the medical community, like, please just stop. But just because it hasn't surged in wherever you're at doesn't mean that it won't or it can't. And it's really unwise to not consider all of the information from, again, people that have nothing to gain from saying that this is happening, and from being in places where they're experiencing this and watching people die every day.
Yeah. How long ago did you have this argument with this nurse? Because there was just a nurse in Kansas City who died of COVID-19.
It was in the past week.
Okay. I don't remember what day this nurse died, but there's a nurse who worked at research who passed. So.
It was after that.
Wow.
And I think it was after, I know there were 500 people or something that were laid off from Children's.
Oh, okay.
Children's Mercy. And so people are really upset about that, because they're like, our ICUs aren't full, we shouldn't be doing this right now. And so, I was just talking about how in, our hospital, we are having to lay off people because the cafeteria is open, and we're not, needing as much of that staff as we were when we were still doing all of the elective stuff and having clinics be open or more accessible. And she was just really adamant that it's all just fear mongering, and I was like, it's really not. Just because it hasn't happened in Kansas City doesn't mean it won't, and you should do everything that you can do to try and prevent it from getting worse.
Yeah, we don't want it to happen.
So by closing those things, you're helping prevent it from happening. And obviously, like, losing your job is a huge deal, and there are so many people that don't have savings for a week, let alone a month, let alone months on end. So I get that, that is scary and that it's hard, and a one-time $1,200 check doesn't negate that by any means. Like, I totally understand why it's stressful, but compared to 50,000 people being dead already, like,
and to have to die alone too.
Yeah, that is one of the things that has really hit me the hardest. Like with this 26-year-old patient I had that died, he was in the ICU. His family, some of his family members had COVID, recovered, and we're back home and really, really wanting to come and see him in the ICU, especially when we told them, it's not looking good. We don't think that he's going to make it through the night, and them not being able to, just like the fact that these people are dying alone.
That's so tragic. It's so tragic.
It's not like there's just like all this stuff to, come in and sit with them and hold their hands. And, people, like, obviously the nurses and the doctors and the staff that are in those situations are trying to be as near and available and caring and loving as possible, but it's just like that's the reality. And even if they are there, like, it's not a family member, like, it's some stranger that's holding your hand when you're dying, and that really sucks, and is one of the things that I think has been the hardest for me, just to, like, see it. Because it's one thing to, like, know that it's happening, but when you actually see it happening, that's really traumatic, and just hard to wrap my head around.
I bet. Yeah. Wow. How are you coping emotionally? Do you, like, it's heavy. I'm sure it's really heavy.
Yeah. It is. So it's it's only been 5 days, and there's definitely been a variety of ways that I've been feeling. It's been kind of all over the place. A lot of crying, and just allowing myself to be like, this is where I'm at, and I was thrown into an, like, impossible situation, and so just allowing myself to grieve that and to say, this is really hard, and there's no way I could have been prepared for this. So that's one thing. Just to, like, have grace with myself in that.
Yeah. Sometimes, what else can you do? I guess.
Listening to a lot of worship music, journaling a lot, talking to my friends, both, other doctors, to just be like, I ran into one of my friends in family medicine, coming into the hospital as I was leaving, and we stopped in the parking lot, and we're just talking, and we both started crying, just, at the tragedy of what's happening, at not being able to hug each other in that moment. And yeah, so talking to people, journaling, listening to music, crying. Lionel has been super kind.
That's nice.
That just feels like such, like, a God thing that he showed up on the 11th as this, like, neglected dog, and yeah, and then this all started a week ago, and coming home to him has been really great.
That's good. You two can help each other out.
Yeah, it looks like you guys have bonded pretty
Yeah.
well already. Like,
He
that's
just curled
amazing.
up with you.
And he was like, I think you need to work with him on separation anxiety. And I was
Yeah.
like,
Aw.
if he can see me, he freaks out.
Yeah. He's sweet though. He looks real sweet.
He is.
Right on. Well, is there anything else that you want to say about the kind of hospital experience, or are you ready to move on to something else?
I think there's one other, it's not really a conspiracy theory, but one thing that people are saying that has really bothered me. It's a lot of like Jehovah over Corona. My God is bigger than
Yeah.
I'm gonna just like live my life as I would normally and just trust that God is gonna protect me. And as somebody that like is still very active, in the faith community, and that still, just like values not all of, a lot of the stuff that I, was raised in, and, still very active in my church community, that is just so frustrating to me, because, I kind of equate it to if there's a hurricane coming and the meteorologists are saying, hey, there's this huge hurricane that's coming, you got to evacuate. People follow that, and there, are some that don't, and they're obviously putting themselves at much higher risk. And, that would be like somebody standing out in the face of a hurricane and saying, my God can save me. But then, just to add the level of this being an infectious virus, it would be like if by doing that, they dragged every other person that they had come in contact with in the past 2 weeks out with them. To say, you're all going to believe with me that God can save us. And that's not to say that I don't believe God can do miracles and can save people, but he's also given us people with training to say, like, here are the appropriate steps that you can take to try and protect yourself. And here's how you can live with wisdom. And I don't think that listening to somebody that has decades worth of training in this area, that they're an expert in, I think that not listening to them shows more pride than it does actual faith.
Yeah.
So, like, just being willing to really examine your heart and be like, am I doing this because I'm prideful, or am I doing this because I genuinely feel like God has called me to, go out and still go to that party, like, or what, whatever it is. So just
like, please just, if that is you, really examine your heart and consider that that's not actually faith, that it's really just pride. Like, God hasn't called us to go to a church building, he's called us to be the church. And one way that you can do that is, trying to protect your brothers and sisters. And you can do that by staying home.
Yeah. And I mean, I know, like, with the church my parents go to, they film stuff. They have their sermons online or whatever, and even like worship services online. So it's like, you don't have to meet in a building. So
there are definitely ways to get around this, and I realize that that's not possible for everybody. Like, not everybody has a phone or computer or internet access. And I get that. But again, I don't think it was ever about like going to a specific building. And I've heard stories about people like going to houses and having conversations through the window pane, or like from they're standing on the street corner and the person comes out to their porch or their front yard. So still seeing people, but doing it in a safe manner that like lines up with what the experts are saying is the safest thing that we can do right now.
Yep. Well, Gabby, I'm curious about how long has it been since you did one of those hashtag when dying alone is a better option posts?
I do not know. It's probably been over a month, I think.
Well, yeah, if you wouldn't mind, could you explain what the hashtag is and like what led you to start posting those? Because it's, yeah, I mean, it's kind of funny, it's kind of sad, and it's always like really interesting to read and really telling about our society, I guess. Yeah.
So yeah, like you said, the hashtag is when dying alone is the better option. And basically I am just telling stories about, true stories of things that happened to me, of things that people say on the street, or, various places that I go, of ways that they're trying to hit on me. And so it started, I'm not sure when I actually started using that hashtag, but since I was about 13, just ridiculous things have been happening. Some that are more funny than others, some are just, genuinely terrifying. And the reason that I post it is because I want to just kind of help spread awareness of the things that women go through.
Yeah, I think some men just don't even know. Like the nice guys or the men who like don't do those things. They sometimes just have no clue.
Yeah.
They're just so clueless to like the whole experience because they're not witnessing it or something,
This, especially I think coming from conservative people, there's this idea that like, oh, she was wearing something, she was asking for it.
Right.
People have told me, well, if you didn't go to the types of places you go to, these things wouldn't happen. And I'm like, oh, so I shouldn't go to grocery stores or gas stations or walk my dog or go get pizza or...
No, you're just supposed to be in the kitchen. Nowhere else.
Yeah, definitely.
With everything covered, including my ankles, because I wouldn't want to tempt anybody.
Right. Because sometimes those ankles. Whew.
Well, let me tell you, I've got some real nice. Side note, when my sister got married, I told my mom, I was like, I'm going to start working out, trying to get in shape for the wedding. And about a month later, she comes over and she was like, have you been working out? Your ankles are looking so much slimmer.
Of all the things to like hone in on.
Yeah, so that's kind of where it started, just wanting to like create an awareness that like this is something that happens. And the reason I do it in the way that I do is because I think that when you add humor to anything, it makes it more palatable, and people are more likely to continue reading an extremely long post, if they've laughed, and that is also just kind of one of my coping mechanisms, and a way that I moved through the world for as long as I can remember. And sometimes they are just really hilarious, like just like, how did you think that this was gonna work? Like,
sometimes it's just like when that went through your mind to act or say that, it's like, but what
is there like one that like is super memorable that maybe is not too traumatic to remember? Okay, maybe an example.
My all-time favorite, actually, I'm going to tell two. One is really brief. I was at a bar in Westport, and this older gentleman wearing a huge cowboy hat, cowboy boots, like had the whole accent, all of it. He walks up to me and he goes, "Ma'am, I just wanted to let you know that you are sexier than the socks on a rooster and built just like a Clydesdale." Did you just give me a horse, sir?
Wow,
a
you're
horse with really hairy feet? You didn't call me like, like beautiful stallion or whatever. Like, you called me a workhorse with hairy feet. And also, when was the last time you saw socks on a rooster, and why was that sexy? That's That's my
Beats
favorite
me.
pickup line. But my all-time favorite thing that's ever happened, I was at a Chiefs game, and it was one of the really, really cold games. So I was like wearing multiple layers. There was nothing revealing.
You're basically going to be built like a marshmallow at that point, right? Like, yeah.
Yeah. Built like a marshmallow. Not that matters, but
Right.
I looked at that just for, because it makes it even funnier. So, at a football game, like, there's a touchdown, everybody's high-fiving, all the people around you, whether you know them or not. Like, it's just, like, a really, like, you all come together for this one purpose. And there was this guy in front of me, had to be in his 70s. Like, this was not a young man. And we had high-fived on the previous touchdown or play or whatever it was. And he turns around and just stares me like dead in my eyes and takes his pointer finger and he just reaches out and he sticks it up my nose and then he starts just going like this.
No.
Like, in my mind, like, when things like that happen, I should respond like punch him, slap him, run away. I just froze. I was like, what is happening?
I never know how to. I mean, I've never had anyone stick their finger at my nose, but I've never like been able to like think quick and like do some. I'm always just like, even though you shouldn't be surprised, it's like you're still so taken aback. It's like, what do you even do? Yeah.
And I think just also the idea that like we are supposed to be super grateful, like when somebody's noticing us, like I should be so flattered that you paid attention to me, that I should thank you for this experience of whatever it was, like whether you said something catcalled,
picked my nose,
and called horrible names when I don't respond, but that's a whole other story. So back to this guy, he has his finger at my nose, and I finally was just like, what? And he says, well, you just looked like you were horny. You like things stuck in different orifices.
Oh, Jesus. No.
Oh, oof.
Oof.
But your nose, though? Like, I've never been that horny.
You used the word orifice in a pickup line.
Damn.
That was like, no. Your finger was up my nose. Just like, there were so many things that were off about that. And then I was sitting in between two guys, and they both were like, okay, dude, like, you gotta go. And then he turns around a little while later and he goes, was that too far? And I was like, too far up my nose or too far in what you said? Because yes, on both accounts.
Yeah.
Check and check.
Definitely.
Yeah.
Too far.
Yeah.
Too far, buddy.
I think, this is, women so often have been catcalling and saying and doing both just ridiculous and offensive and terrifying things, but I, for whatever reason, just have a special gift that the people that do that to me do it in the weirdest ways.
Yeah, I don't know how. I just...
So, yeah. I just heard enough people making comments about, like, oh, she was asking for it, blah, 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 that was one reason that I wanted to make those posts. And then also just this idea that is, I think, again, really prevalent in Midwest conservative Christian culture of, like, get married when you're 19 and immediately start having kids, and that's the best thing that you can do. And as somebody that's almost 30 and single, and my longest relationship is 3 months, like, I'm not somebody that has really dated much, that idea can be really just like hurtful, especially in those times where I'm feeling really lonely and really wish I was in a relationship. Like, this just like, oh, you should just settle for whatever is there.
Yeah.
And it really, like, sometimes dying alone is the better option. Like, that really is the best thing that I can do for myself, is to remain single in this moment.
It's better than settling. Definitely better than settling.
absolutely. So, and I've, had so many friends that got married when they, well, regardless of what age they got married, but just like did it because it was the thing to do, the thing that they were expected, or the thing that they had in their 10-year plan that they made when they were 18. Like that was the next step, and so they just did it because it seemed like the right thing to do, and then got into really horrible marriages, and have seen just like so much devastation come through that. So even though I try to present it in a really funny way, at its heart, there's, I think, those two more serious things that I try to address through those posts.
Yeah, absolutely. Yeah.
Got it.
Yeah, and so, I mean, because of that, like, I mean, as a woman, and you deal with all this misogyny and just the ridiculousness that we women deal with, and like, as someone who's still a Christian, or a Christian and who's still really active in their faith, how are you feeling about seeing like Christians in support of Trump, who has been, known to be very misogynistic and also has like rape allegations and other sexual assault allegations, like, not to mention his medical advice of, injecting yourself with disinfectant or...
People have died because of that. Like, since he said that, there was a guy that I think, don't quote me on this, but I think he was an engineer, like highly educated man who drank a teaspoon of bleach. He and his wife both drank a teaspoon of bleach. He died. He ended up hospitalized.
How does that happen?
Like, the poison control centers are getting just like calls off the...
That's so crazy. And I mean, and then to come back and be like, oh, I was being sarcastic. Like, you're not supposed to just be sarcastic as president. Like, you
would think.
Sarcastic. Like, go watch that clip. There was not a hint of sarcasm in there. And B, if you are being sarcastic, that is wildly inappropriate in this situation. Like, literally hundreds of thousands of people are dying, and you think that this is a good time to make jokes and be sarcastic?
As a president, just don't. Like, you can be sarcastic at home with Melania or whatever. Yeah.
Yeah. That is something, as far as your initial question, I have grown so much in the last decade, since starting my whole like medical school career, and now being a physician, where I came out of high school totally on board with, you vote Republican or you want babies to die, and that's the most important thing that we can do, and nothing else in politics really is ever going to live up to that standard of importance. And so I don't even bother to pay attention to anything else, because this is the only thing that matters.
Right.
And so the way that has kind of transitioned for me, now being somebody that was like hardcore, feeling the burn, Team Bernie all the way, but like also just no longer identifies in any way as a Republican, but still identifies as Christian. So the first thing that really happened was one of my best friends in medical school, who is still a really good friend, told me I was ignorant, and that made me so angry. But I also couldn't refute it, because like we would have conversations and he would be talking about like politics and history and all this stuff, and I was just like, I don't really know anything about that, but pro-life. And so I started to do more research. It was like listening to podcasts, paying attention to the news, knowing what was going on, regardless of whether I agreed with it or not. I think it's important to be aware of what is happening. And there are a variety of different ways that you can do that, different sites, but trying to find places that are as neutral as possible. So I really like Associated Press and NPR.
Because they never, say, oh, Trump's an idiot, or Trump is a great man of God who's doing all the right things. Like, it's just, these are the facts. This is what he said. This is what happened.
Yeah.
So that's why I like those two. But
Cool. That's actually a question I had been thinking about asking, is like what sources you like to read or listen. So cool.
yeah, those are the two places I get most of my news from. But yeah, so I started listening to more news and just becoming aware of all of the injustice that is happening in the world. And I think that amplified so much when I ended up at Howard, which again is a historically Black college and university, and went from a majority white community to a basically all minorities, and just being more immersed in the inequity, which is present on basically every aspect of life. Like, we're seeing that in COVID. The people that are dying the most are African Americans, even in cities that have like 6% Black people, 90% of the deaths are Black people. And so, then just like looking at the reasons that is happening. And so yeah, becoming more aware of all of the injustice in the world. And something that another friend said to me years after the first friend told me I was ignorant, somebody said, if Jesus was here right now, I don't think he would be a Republican.
For sure.
And that idea blew my mind. Like, I had just grown up, like, of course he would be a Republican. And then, that friend started to talk about like things in scripture. What does Jesus say about the poor and the sick and the widowed and the outcasts? And I just like had this realization of looking at things that the Republican Party stands for, that it's like, whoa, that none of that lines up with what Jesus said and who Jesus is. Like, it just isn't there. Like, there's such a disconnect. And I think most of the people that I know from back home that are like hardcore Trump, it's all surrounding abortion. And so I think that it's really dangerous on any level to claim Jesus or align him fully with anything that we do, right? Like, I don't think that Jesus would be a hardcore Democrat in every situation, or hardcore Republican in any situation, or would only go to churches that play hymns, or would only go to churches that only do rap music. Like, when we try to make Jesus fit into the box that we've created and we're comfortable with, like, that's automatically just, we're creating an idol. Like, that's not who Jesus is. And so that's why I feel like it's so important to look at all of the different areas. Like, you can feel like Trump has done a good thing in this one area, but I think it's ignorant, and there is a lot of like you were saying at the beginning, the misogyny, there's racism, there's so many other issues that I think you have to look at all of that and not ignore that just because you agree with him on this one issue. Even if at the end of the day you still decide this is the most important thing for me and I'm still going to vote based solely on abortion, I think you have to really sit with all of the other ways that being Republican does not line up with Christianity. And if you can't do that, I would argue that you're faith and your relationship with God is not that strong. If you're so scared of being challenged in that way and letting yourself, again, just really sit in that discomfort of like, maybe all of the things that I learned aren't the only way or aren't the correct way, aren't the most godly way to think about this. I really don't think your faith is as strong as you would probably argue that it is.
Yeah.
And then just a last little plug about abortion. Where I sit now, so I do believe that life starts at conception, but I think there's a couple different issues that we need to really acknowledge, especially in the Christian community. So one, I hate the terms pro-life and pro-choice, because I think that just at its baseline is already like really polarizing, and it makes it easy to attack the other side instead of listening. So, people that identify as pro-life, the pro-choice people would say that you don't care about a woman's right to choose and you don't care about women. And then the pro-life people are going to say, well, you don't care about babies. And none of that, I think, is true. Like, the heart of it is, where do you believe life starts? Like, do you believe life starts at conception, or do you believe life starts at 15 weeks, 20 weeks,
Sure.
at birth, whenever, and that's not something we can scientifically prove. So you have to at baseline acknowledge that you are, that this is a subjective thing, that you believe this because your faith, or you believe this because this is the best knowledge we have about, like the development of human life. So that's one thing. But my biggest issue with people who vote, especially for Trump, based solely on abortion and pro-life, is that looking at the numbers, making abortion illegal does not decrease the number of abortions.
Absolutely.
So, people want this, pretty package of America being this Christian nation. They want it, everybody to go to church, and they want everybody to get married before they have sex, and they want there to be, abortion as illegal. But they don't acknowledge the fact that even if abortion is illegal, people are still going to be doing it, right?
It's still going to be happening. It's just going to be in back alleys. It's going to be by people that aren't trained in it. So you're going to have increased maternal mortality and morbidity. So how can we actually decrease the number of abortions? Education, healthcare, doing the things that actually decrease abortions is more important than having this pretty picture of, oh, we're a nation that has abortions being illegal, but they're still happening. It's just not in your face, and there's not, numbers, being reported by all of these pro-life places.
It's the same exact conversation as addiction to a lot of controlled substances. It's the exact same conversation. It's like, if you outlaw it, lots of people will do it. Lots of people will die because of the cartels doing it illegally and all this. And then the addiction rates don't go down. In fact, in some cases, they go up, and the mortality rates are dramatically higher. It's this exact same conversation, and it's fascinating to me. I've never made that that connection,
Yeah. With the addiction and drugs and the war on drugs, where high up officials that were working in creating that war on drugs have come out years later and said that wasn't a war on drugs, it was a war on Black people.
Yeah.
The guy working in the Republican Party who helped start that has literally said, we knew that it wasn't about marijuana. It was about Black people. And it was, just a fight to get Black people incarcerated. And so I understand that there are people that are still going to vote for Trump and that are still going to support Trump, but I would just really challenge you, if you're one of those people, to, obviously I know you're not one of those people, but you whoever is listening, to sit with all of the other issues and to really do, like, put the work in to do the research and then correlate that with scripture or with, whatever, thing you use as your moral guideline, and ask yourself, does Trump really line up with that? Or are you just voting this way because this is what you were taught to do and you're too lazy to do the work?
Right. The moment that was crazy and eye-opening for me in 2016 when he got elected was a Facebook post by like a Facebook friend, not anybody I know too well, but it was a picture of the United States, and it was like the red states and the blue states, like who voted which way, right? And there was more red states because obviously, like, the big, like California's blue, like there are more red states than blue states. And so it was a picture of that, and then the caption was something along the lines of, like, all I can see is the blood of Jesus all over the United States. I was just like, wow. That is unbelievable. That blew my mind. I was like, oh, God.
I've seen some ridiculous ones. I have not seen that.
Yeah.
That takes the cake, probably.
So many people that I know and love recently posting, like, oh, thank God we have, like, this man of God in office. And I'm like, it genuinely infuriates and offends me that you would claim Jesus over, like, as connected to this man in any way.
Yeah.
Like, it blows my mind that people are so hung up on this one issue. And again, I'm not saying that abortion isn't something that I think about or care about and want to see decrease. I think everybody would like abortions to decrease, whether you're pro-life or pro-choice.
Right, because pro-choice, I mean, the pro-life people, I understand their arguments, but it's like they vilify pro-choice so much. But it's like pro-choice people are not pro-death. Pro-choice doesn't mean pro-death. The opposite of pro-life is not being like, Yeah, so it's...
They just want to see abortion decrease by decreasing the amount of unwanted pregnancies, and you do that through education and healthcare.
Yeah.
Right, and affordable healthcare, affordable options for birth control, and education for sure. Yeah, so... Wow.
Yep.
Yeah, wow.
Yep.
Here we are.
Yeah.
Here we are.
A lot of my friends, so I love talking about controversial things. Like, and I don't care what you believe. Like, as long as we can have a logical, as long as we can have a conversation that doesn't turn
Like, as long as it's not a yelling match, we're fine.
Yeah, exactly. Like, I love having those conversations because that's how I've grown and changed, is by talking to people that don't believe the same thing as me, but we can have a conversation. And so my friends will joke that, like, I like to meet people. I'm like, hi, I'm Gabby. What's your thoughts on abortion? I love jumping into the most, like, controversial, hard topics that people like to avoid.
Yeah.
That's great. Oh, man. Yeah, not everyone can just jump in like that. I
like to think a little more smooth, but probably.
Oh, very cool. What else we got? We kind of touched on a lot of things here.
This has been amazing, Gabby. Thank you so much.
No, I mean, this was really fun for me.
I'm glad.
I'm totally glad. Yeah.
Yeah. Really glad. Thank you. I hope you're hearing thank you enough, but
yeah, I mean, especially because I know you're so busy and your time's limited, so we really appreciate your time talking to us.
Right, if you're not hearing it enough, then I'll say it anyway. Thank you for all the hard work you're doing. Thank you for putting yourself on the line and putting yourself through stuff I can't imagine to really help people. Thank you. Thank you.
You're welcome. I never know how to respond to that. I'm like,
yeah, I'm sure it's kind of like awkward sometimes, but
I just the way that you like to say hi, I'm Gabby, what do you think about abortion? I like to just acknowledge people intensely and just let them like feel awkward. That's what I like.
Yeah, that's true.
Doing it, it's so needed. Like we need to be,
Or I can't say I need to be better about being able to take compliments and encouragement, because I tend to be so hard on myself, and just expect perfection, and if I don't meet it, then in my mind I'm a complete failure and disappointment, and so it's encouraging to have people like you that are willing to like have that awkward moment. So, and even though at times it feels uncomfortable, receiving it doesn't feel uncomfortable, but just like not knowing what to say afterwards, because it's like I'm just doing my job.
Yeah, I get that.
It's so encouraging, because so many people like you we talked about at the beginning are saying these horrible things about medical professionals and saying that we're lying and we're doing whatever horrible thing. So it's encouraging to like get that like acknowledgement that like this is a hard thing that we're doing, and it's a scary thing that we're doing, and we're
Yeah.
brave and courageous and strong by doing this. So thank you.
You bet. Well,
Yeah, you are absolutely courageous to be doing what you're doing. And I know it takes an incredible amount of just strength, mental strength and physical strength if you're working 24-hour shifts or whatever. And, so yeah. However you're feeling, you are doing great. You're doing great
You're
to
doing
be doing
great.
it, like you're doing amazing. I know it's all got to be really heavy and really stressful, but like, yeah.
I'm doing it.
You're doing it.
sure.
But yeah, and so because you're doing it, it was like so valuable getting your medical and professional opinion on some of these issues. So I really hope that if anyone listens to this, they can kind of glean some knowledge from what you've been saying. So,
All right. Well, I guess we can end here and say goodbye and wish you the best. And thanks again for taking the time and hanging out with us today.
Thank you for having me on. It was
and it was really good to just see your face again. It's been a while, so
I've been home since September, so this is the longest I've ever been away from home. And it's all just like nice to see somebody I've known longer than 3 years.
Yeah.
Well, hopefully we can see you in person sometime. Sometime down the road. That would be wonderful.
Yeah. Post-apocalypse,
Whatever. Yeah.
All right.
Thanks, Gabby.
Much love to you.
Bye.
Bye.
Bye.